Good day, everyone. Thank you for joining us for this webinar, which is part of the Ask Professor Agnes monthly webinars. Today's webinar is entitled, How to Build Resilient Health Systems to Mitigate Health Threats Due to Climate Change. My name is Florence Akiki Bitarabiho. I'm Assistant Professor and Head of Godley St. Gore Department of Community Health and Social Medicine at the University of Global Health Equity. The Community and Social Medicine Department has 4 pillars. 1, health professionals education. Our flagship program is community-based education. This is a transformative education that has community-based platforms and thus is dubbed the University Without Walls. It is patient-focused, family-oriented, and with context-specific technical content. 2, research that involves community engagement. 3, advocacy that tackles expressed needs of communities. And 4, action that is mutually reciprocal as service to partners and learning platforms for students. Our webinar today is in line with the UN World Health Day, whose theme is Our Planet, Our Health. And it will address the topic of how to build resilient health systems to mitigate health threats due to climate change. This Global World Health Day marks the founding of the World Health Organization in 1948 and is celebrated on the 7th of April every year. This year's theme, Our Planet, Our Health, has the main aim to call for urgent actions that will keep humans and the planet healthy. Having navigated through a pandemic, an increasingly polluted planet, and a rise of diseases that include, but not exclusively, cancer, asthma, and heart disease, the aim is to promote the creation of societies that are focused on our well-being. It is no coincidence that this is the theme of the year, given that WHO estimates that across the world, on a yearly basis, there are more than 13 million deaths caused by avoidable environmental causes. This includes the climate crisis, which poses the single largest health threat that humanity faces. To address this topic, we have distinguished speakers who are steeped in professional experience and scholarly work. It is therefore my pleasure to introduce our speakers now. First of all, Dr. Tarun Weeramanthri. Dr. Weeramanthri is the Professor of Public Health Association of Australia. He is an adjunct professor of School of Population and Global Health, University of Western Australia. Tarun is a trained specialist in internal medicine and public health with a PhD in social medicine. He was Chief Health Officer in the Northern Territory of Australia from 2004 for 3 years, and in Western Australia from 2008 for 10 years. In 2014, he was awarded the Sydney Sachs Medal for his contribution to public health in Australia. From 2019 to 2020, Dr. Weeramanthri conducted a significant statutory inquiry into the impact of climate change on health in Western Australia. Dr. Wiramanthri, we welcome you. Next is Konei Kili Ntihabose. Dr. Ntihabose is the head of the Clinical and Public Health Services Department in the Ministry of Health in Rwanda. He has been working in health delivery for 8 years. Prior to his current position, Dr. Ntihabose worked in several district hospitals in Rwanda, including as Director General of Byumba Hospital. He worked at Rwanda Biomedical Center on the treatment of scaling up of hepatitis B and C management. Dr. Ntihabose earned his medical degree in the National University of Rwanda and attained a Master's of Public Health from Mount Kenya University. He has published articles and abstracts on HIV, hepatitis, global ear health, and maternal and child health. Dr. Ntihabose, you are welcome. Ramon San Pascal. Ramon is the Executive Director of Healthcare Without Harm. He has held 2 other Executive Director positions at the Asian Forum of Parliamentarians on Population and Development. Also at the Philippine Legislators Committee on Population and Development. Ramon has had academic positions as a health economics faculty member at PUP College of Social Sciences and Development. Also as a professor at the University of the Philippines Population Institute. In 2015, he served as the head of the Philippine Department of Health Legislative Liaison Division. He was also the logistics consultant for the Department of Health RPRH Law National Implementation Team. He earned a Master of Public Health degree from the University of Washington in Seattle and was a Gates-Packard Fellow in the Population Leadership Program at the same university. Ramon, you are most welcome. And now Michael Jenkins. Michael Jenkins is a founder and CEO for Forest Trends Association. For 10 years, starting in 1989, Michael was the Associate Director for the Global Security and Sustainability Program of the MacArthur Foundation. In 1998, Michael was in a joint appointment as a Senior Forestry Advisor to the World Bank. His other work experiences include working as a Peace Corps volunteer in Paraguay, working in agriculture, apiculture, and forestry projects in 1970. He also worked as a technical advisor in a Washington-based development organization, Appropriate Technology International. He was also an agroforester in Haiti with the USAID Agroforestry Outreach Program for 3 years. Michael holds a Master's of Forest Science from Yale University. He has contributed to and authored numerous books and publications, including The Business of Sustainable Forestry, Strategies for Industries in Transition, Capital Markets, and Sustainable Forestry, and Opportunities for Investment. In 2020, he received the Skoll Award for Social Entrepreneurship, and in 2015, the Social Entrepreneur Award for the Schwab Foundation. Michael, you are welcome. And lastly, it's my pleasure to introduce the chair of this webinar, Professor Binagwaho. Professor Binagwaho is the Vice Chancellor and co-founder of the University of Global Health Equity, UGHE. UGHE was founded in 2015 as an initiative of partners in health based in Rwanda. UGHE focuses on changing how healthcare is delivered around the world by training global health professionals who strive to deliver more equitable, quality health services for all. Professor Binagwaho is first and foremost a clinician. She is a professor of pediatrics in UGHE and Dartmouth Gizo School of Medicine. She is a scholar of note. She has published more than 220 peer-reviewed articles. She is an educator at UGHE, at Harvard Medical School, and other institutions. She is a member of multiple editorial, advisory, and directors' boards and foundations, and professional bodies. She's an advocate for human rights, social justice, and health equity. In recognition of her work, she was awarded the L'Oreal Women's Science Award for 2022 for Africa and Arab states. Professor Agnes served the Rwandan health sector from 1996 for 2 decades, first as a clinician and subsequently in high-level government positions as the Executive Secretary of Rwanda National AIDS Control Commission, then as Permanent Secretary of the Ministry of Health, and lastly, as Minister of Health for 5 years. It is no surprise, therefore, that she was named among the 100 most influential African women for 2 consecutive years in 2020 and 2021. Professor Agnes, the floor is now yours.
Thank you, Dr. Akiki, for the warm welcome to all of us, and also for hosting today's webinar in the Department for Community Health and Social Medicine at UGHE. I think that the work you do in your department is truly essential to our effort to achieve our mission to radically change the way healthcare is delivered around the world by training generation of global health professionals. Today, we are joined by a global audience, so I greet all of you and welcome all of you to this month's Health Professor Agnes Equity webinar. Dear estimate attendees, expert panelists, and global health enthusiasts. I'm pleased to wish you good morning, good afternoon, or good evening, whatever place you are in the world. This webinar is a global platform created to discuss global health threats and challenges and to serve as a way to advocate for change and improvement through insightful discussion with experts working on these issues in their day-to-day work. These experts will provide recommendations on how to prepare for better response to future health threats regardless of their causes. Before we proceed, allow me to share some logistical information. To include and provide access to people who are hard of hearing, please access the closed captioning function on the bottom of your Zoom screen. And you can access this by clicking on the closed captioning CC button to benefit from real-time text translation. For persons with visual impairment, our panelist has been prompted to be more descriptive of the image that are on their slides. Lastly, feel free to submit your question in the chat box for the live Q&A after the presentation. Every month, we run an Ask Professor Agnes webinar aligned to an International United Nations celebrated day. This month, the United Nations commemorates the International World Health Day, and the theme, as Dr. Akiki told us, is How Planet, How Health. And we align today webinar to that because we are going to discuss how to build resilient health systems to mitigate health threats due to climate change. Nobody can deny that climate change affects everyone without regard to the color of their skin, their gender, their nationality, or social class. Of course, the vulnerable are more affected than the wealthy. So, as global citizens, this should concern each and every one of us. And according to the World Health Organization, between 2030 and 2050, climate change is expected to be the causes of 250,000 additional deaths per year, including 95,000 deaths from childhood malnutrition, 60,000 from malaria, 48,000 from diarrhea, 38,000 from heat stress in elderly people. The financial expense for damage are also estimated to be very costly, between more than 2 billion, between 2 and 4 billion per the year 2030. And of course, the poor country will pay the cost more, even if they contribute less to the problem. The Intergovernmental Panel on Climate Change had concluded that to prevent millions of climate change-related deaths, the global temperature of the world had to be limited to 1.5. However, in 2019, the report indicates that most likely we are going to exceed that. And it was estimated that we may reach 3.2 degrees by 2100. So in 2021, the climate change report proved this point, and we were quite devastating for many parts of the world, with many occurring disasters in Europe, in Asia, in Africa now. New disaster or disaster at a rhythm and with an amplitude not seen before. The impact of climate change has been enormous. For instance, on the African continent, we had 195% more Africans affected by extreme weather, even if we compare that to the year before. A total, I'm not going to go in the total of disasters that has been growing across the world. So for another example is the increase of hurricanes. We have seen in Africa what happened in Mozambique up to Malawi, and recently in South Africa. And the other continent is the same. It is important to note that the increase in temperature is highly due to an increase of greenhouse emissions that are largely contributed by the G20 countries that emit more than 80% of all greenhouse emissions, compared to the continent like ours in Africa that emit only less than 5%, but still face global warming effect. And the correction to that, it asks to our continent to slow down our development just because the rich country has misbehaved knowingly for years and are still doing it. Because if we ask to slow the fossil fuel use, all the big factories that are extracting fuel on the continent are still continuing to do that. So when discussing climate change, it is important also to consider the inequity, the social determinant of health, because social economic inequities expose more the vulnerable to those stress, the elderly, the poor, those who have no money to buy increase food, that the cost increase because of the global warming. According to WHO, health crisis is expected to undo the 50 years progress that we have done last cycle. So it's urgent. If we want to achieve universal health coverage, we need to build resilient health systems that are aware, adaptive, diverse, integrated, and self-regulated. And also for the health sector to stop contributing to the greenhouse gas emission, because we contribute for around 4.5% to make the people we care of sick. So this is especially true for health system in the rich countries. So my hope is that at the end of this webinar, we have not only heard from experts the effect of climate change on our health system, but also listen, and take home actions on how we can work together in our communities and nation to proactively address these threats and be prepared for them by taking care of our environment, each of us. Before we go further into the discussion, let me begin by asking each of our panelists to give their introduction remark. Join me first to welcome Dr. Tarun, all the way from Australia. He will be sharing with us the effect of climate change on Australian health system and how they have responded. Dr. Tarun, we are going to listen to you.
Thank you for the invitation to speak today. My name is Tarun Wiramanthri, and I'm president of PHAA, the Public Health Association of Australia. I'm based in Perth, Western Australia, and would like to begin by acknowledging the Whadjuk Noongar people, the Aboriginal traditional owners, paying my respects to their elders, past and present, and thanking them for their stewardship of this land for 60,000 years. In 2019 and 2020, I conducted a year-long inquiry into the impact of climate change on health in Western Australia for the state government. The final report is easily found if you Google Climate Health WA. In a country as vast as Australia, all 7.5 million square kilometres, geography really matters. Western Australia occupies the western third of the continent, and the focus of our report was on the impact of climate change in the different local regions, as seen on the right of the slide. Australia is on the frontier, the front line of climate change. You'd be familiar with the pictures of raging bushfires from the eastern states in 2019, followed by devastating once-in-500-year floods just this year. But Australia is also like a large frying pan, heating up quickly. Just this last summer in Perth, the average temperature was over 2 degrees higher than normal, and much of the tropical north of Australia is becoming, frankly, unlivable. Indeed, heat waves have caused more deaths in the last 100 years in Australia than all other natural disasters combined. The science is in, the health impacts are real, and the public are convinced as they have lived through it all. The increased risk of these extreme weather events is climate change related, and the physical and mental health effects, direct and indirect, are now obvious. Professor Agnes asked me to reflect on the impact of COVID. There is no doubt that such a pandemic has drawn attention away from climate action in the short term, and though there was a temporary reduction in emissions in 2020, that has now reversed and the trend line upwards has resumed. We've also seen the response divide countries, particularly on the basis of income, privilege, and development, but also open up divides within countries on the basis of gender, ethnicity, and socioeconomic status. My strong suspicion is that the world is much more unequal now than 2 years ago. Weaknesses in health systems have also been exposed. However, there is a potential upside for climate action too. Firstly, no one can say there isn't enough money to fund the transition to a new renewables-based economy. Any such cost would be a fraction of the money spent on responding to COVID. Secondly, we did pull together at certain points and support vulnerable people. I remember that early in the pandemic, homeless people in Perth were all housed in hotels, and income support was provided generously across the board. These are good precedents for the future. And lastly, clinical and public health people have worked together like never before, and such partnerships will be needed for climate action in the health sector, so we can address both mitigation through our clinicians and adaptation, which is more a public health response at the same time. In terms of the best and worst of health system responses, major health professional groups in Australia have been almost universally supportive of the need for climate action on health grounds. Australian researchers are doing their best to get the facts out there. We were the first country to produce our own annual country report to complement the International Lancet countdown work, and it has been estimated that the health sector contributes 7% of all emissions in Australia, a considerable amount. We also have well-established networks of climate and health activists and researchers trying to make connections with and influence policymakers. However, we have no national government position, statement or framework on climate and health due to political inertia, so all the heavy lifting is being left to the states, cities and local governments. Coordination is ad hoc at best. Also, after doing very little in this area for the best part of 10 years, we are still not moving fast enough and don't even have agreement on monitoring baseline emissions from the health sector, let alone have we set goals or targets for reducing emissions in the short to medium term. Net zero by 2050 does not mean much without such interim targets. And there is no dedicated funding for either emissions reduction in the health sector or climate adaptation more broadly. So I'll finish by saying that we definitely need a national climate and health strategy in Australia, and this may become a reality after the Australian elections next month. PHAA is advocating hard for this outcome. It would be great to have a national SDU like in the UK to drive innovation and faster sharing of best practice and technical guidance. We also need further investment to better adapt to the climate challenges such as heat, fires and floods that are already occurring every year or so. And we need health leaders, not just to tell others what to do, but to acknowledge that we as professionals are part of the problem, silent for far too long and needing to change ourselves first in order to then drive change across the health sector. Thank you.
Thank you, Dr. Tarun, for your insightful presentation and highlight challenges that we face across the globe in our respective countries. I'm now pleased to welcome our second panelist, Mr. Ramon, to share with us his remark on these special threats on the Asian continent. Mr. Ramon, the floor is yours.
Good morning, good afternoon, good evening, dear colleagues. Thank you for this opportunity for me to speak up to you on climate change and the health systems in Asia during the pandemic. My name is Ramon San Pascual. I'm the Executive Director of Healthcare Without Harm, Southeast Asia. Let me present to you what are the unique challenges in the Asia region in terms of the climate change and environmental crisis. First of all, even prior to the pandemic, there is this growing mobility and connectivity even among Asians themselves, whether you want to travel to China or to the Philippines or in different places. The connectivity and mobility is such that it provides the ever-present risk of health emergencies, and as it happened, we experienced and we are still experiencing the COVID-19 pandemic. Secondly, the change in consumption patterns, rapid urbanization, and greater longevity in our region have contributed to an increased non-communicable diseases, which now is among the top killers in terms of diseases in Southeast Asia. 4 out of every 5 deaths due to diseases are brought about by NCDs. Thirdly, environmental and climate change are affecting the fundamentals like the air we breathe in terms of the air pollution, the water we drink, and even the ground under our feet. And yet, despite the progress and economic growth in our region, in Southeast Asia, there is still this issue of reaching the unreached people and communities is still afflicted by infectious diseases and high rates of maternal and infant mortality. Now, even during the time of the pandemic, the impact of adverse and extreme climate events have continued to devastate communities, vulnerable population. And in so doing, it also, the climate change also disrupt the delivery of healthcare services. Thus, there's a need to improve the resilience of healthcare facilities such that it will enable hospitals and health systems to continue to provide essential services even during calamities such as strong typhoons and other climate-driven disasters. And yet we also acknowledge that hospitals, healthcare facilities, the sector itself, contributes to greenhouse gas emissions in a big way through energy consumption, transportation, products that are manufactured, utilization, and disposal of what we would later on call as the healthcare waste. In the time of the pandemic, one huge environmental impact it created and brought another crisis is the sudden surge of COVID-related waste. This is not only in Southeast Asia, but much more because even before the pandemic, Southeast Asia is already considered as among the top countries that contribute to global plastic pollution. And hospitals are also part of it, simply because as we did our audit in hospitals, 60 to 70% of the regular waste brought out daily by a typical Asian hospital is consist of plastics. And the PPEs utilized in the pandemic much more worsen the plastic crisis. And this time it is coming off from healthcare facilities. And so let me now segue to what were the creative, innovative solutions taken by some of the hospitals belonging to the Global Green and Healthy Hospital Network. This is the Cahaya Calbo in Indonesia and the St. Paul Hospital Iloilo in the Philippines that are able to save huge sum of money by introducing in the early months of the pandemic washable PPEs, washable and reusable PPEs. It helps them economically, it helps the environment. At the same time, they do not have to encounter the extreme shortage of PPEs at the onset of the pandemic. Other ways of addressing the pandemic-related environmental crisis, as well as pandemic's contribution to the emission, is hospitals do serve sustainably grown food and fostering healthy habits. Take the case of the Buddhist Chuchi Hospital in Malaysia and the West Java Mental Hospital in Indonesia. Thus, we agreed as we look into the lessons of the pandemic more than 2 years now, that there should be continuing actions taken by the healthcare systems. One, we must pursue health equity, climate justice, and secure work. We must secure health for all in our policies. Climate action is necessary within the healthcare sector itself. and healthcare professionals should be considered as leaders and messengers. And we are doing this through the Global Green and Healthy Hospital Network in Southeast Asia. We have at least 100 hospitals growing as members, and the services as you are seeing in the screen. And we also want to invite you, because this is a global network of healthcare facilities, the Global Green and Healthy Hospital Network. Thank you so much.
Thank you, Ramon, for your remark and recommendation and your invitation. We are now going to hear our third panelist, Mr. Michael Jenkins, and his bio has been presented before by Dr. Akiki. So let's listen to Michael.
Welcome and good morning, everybody. Thank you, Agnes, for inviting me to speak to this group. My name is Michael Jenkins. I'm the president of a nonprofit called Forest Trends that works on nature-based solutions to combat climate. As we have seen again and again, recently this last week in the devastation in Durban in South Africa, water is at the intersection of climate change and health. Climate change is water. Too much, too little. Water is essential for health. We know the access to clean water is critical for avoiding waterborne diseases. We know access to water is critical for sanitation and hygiene. We know water is critical for food production, access to adequate food and nutrition as a basis for health. So what we're going to talk about is the intersection of water between climate and health today. Here in the US, we've all heard of some of the climate impacts that have been happening primarily particularly in the western part of the United States. We have massive heat waves, frequency and intensity and duration of these heat waves since the 1950s. There's wildfire frequency and intensity that we've all been reading about over the last 20 years that's getting worse. And there's a current drought that people are calling a mega drought that is the worst drought in the last 1,200 years. So again, water as the intersection between climate and health appears everywhere in the planet and will become even more devastating moving forward. I wanted to show a couple of examples of worst case and best case approaches, scenarios around health and climate resilience. Obviously, in the worst case scenario, like in the United States, we see some, while their efforts to address vulnerabilities in the health system and their efforts to mitigate the effects of climate change, few communities are linking these two and recognizing the interaction of climate impacts and health and the potential synergies among solutions to both. You think about, on the worst case scenario, business as usual, we're talking about a focus of treating the disease rather than addressing the vulnerabilities and building health resilience. We're talking about not addressing the social and environmental injustices that increase vulnerability to health effects of climate. And we ignore the links between deforestation and biodiversity loss and the emergence of new diseases and impacts. Best case scenarios is when we really increasing body of research around indigenous and local knowledge and traditions that verify that nature is the source of health and well-being. Next slide. So it really is about investing in nature, thinking about nature as the hidden health system. Excuse me. You have global health as linked to ecosystem health. We need to reverse deforestation and biodiversity loss. We need to ensure indigenous people's rights, protect protecting biodiversity, their health, acting as climate mitigation. Some local actions, what we can think about is when we use it as, we use the frame of natural infrastructure as a health and climate intervention. Equitable green spaces in cities, urban forests, urban gardens are all critical elements that deliver physical and mental health, climate mitigation, mitigating urban flooding, water quality, and food security. We have a major project in Peru that we've been working on for a decade that uses this idea of natural infrastructure, including ancestral practices to protect critical water sources. This final slide is really an infographic that that lays out all of in a landscape the different kinds of activities that one could take on that would be thinking about investing in natural infrastructure that would deliver great health outcomes. As you see in this landscape, we're protecting the glaciers at the top of the mountains. We're protecting the wetlands that are in that part of that system, the rivers, the streams, all the way down to the cities. That's delivering outcomes that include fewer waterborne illnesses, more equitable access to clean drinking water, water for sanitation and hygiene, reduces the risks of flooding and landslides, and it also delivers gender equity, improved health for women and girls. So the theme of this presentation and what I wanted to deliver today was really that nature is the key to water security, climate resilience, and health. So that intersection is a critical one to continue to address and to think in terms of solutions to health, the health systems and the climate catastrophe that we're facing. So thank you very much.
Thank you very much, Michael, for your insight into the global image of the current climate and environmental status and how it is linked to water, and by controlling the quality and the quantity of water, we can tackle the problem, especially for the vulnerable. Now, last but not least, I'm very pleased to welcome Dr. Corneille to share his introductory remark on the preparedness of the health system to the threats caused by climate change and how Rwanda is tackling this issue. Dr. Corneille, the floor is yours.
Good afternoon. I'm pleased to join you in this webinar by thanking Professor Agnes to invite me. Dear participants, we have prepared a topic on preparing the impact for the impact of climate change on health system in developing countries. My name is Dr. Corneille Ntihabose. I'm head of clinical services department within the Ministry of Health, Rwanda. We know that according to UN Climate Change Report 2020, according to that report, Africa is facing increasing temperatures and sea levels. We are seeing some changes in precipitation patterns, and also more extreme weather are threatening the human health and safety. We are seeing the food impacts and also water security and the social economic developments. This is because global warming can melt Africa's remaining glaciers in the next few decades. And also some parts of Africa have reduction in water essential to agriculture production, which can create food insecurity, poverty, and also some population displacement. Next. The impact of climate change on health system developing countries are huge. If you are seeing on the slide, the first graph, in Rwanda, we experienced in the last 40 years the rise of temperatures in Kigali and also in Kamembe, where they recorded the temperatures. There is at least 1.5 rise of temperatures of Rwanda if you compare to last 40 years or 50 years course. This impacts the social and environmental determinants of health, the clean air, the safe drinking water, sufficient food and secure shelter. And it is estimated that between 2030 and 2050, additional 250,000 deaths will occur in each year because the climate change is having impact on health. The climate change, we know that can reverse, slow down, and undermine the health performance we have achieved if no concrete adaptation measures are made. In Rwanda, we have achieved a lot in maternal mortality reduction, child mortality reduction, improving the fertility, improving also the data on family planning, so the coverage of community-based health insurances, service utilization. But if we do nothing to reverse these climate change impacts, the climate change will continue to have impacts on those achievements and those performance. Therefore, we must do everything. This is because it's primarily because nearly all morbidity and mortality causes in Rwanda are climate sensitive. If you look at the picture, the diagram you have there at on right side, right lower quadrant, primary infection is occupying in Rwanda 34%, malaria is occupying 11%, and also intestinal worms is occupying 11%. So this data, morbidity data, are climate linked and climate sensitive. If you can have changes in climate change, you can have rise of cases of malaria. We have seen 2016, 2015, where we had more cases of malaria because of changes of climates. Next. There are some best practices we can share. We start with the policy which were adopted in 2019, policy on environment and climate change. It has some strategic directions where the government is positioning itself in environment and climate change, what actions can be done. And this policy is accompanied by a strategic plan, which has many activities we can conduct by increasing awareness and some interventions we can do on the ground in order to curb the impacts of climate change on many sectors, but including ours on health. At Ministry of Health, we have created new positions recently. We have public health emergency operation. It is a specialist who is controlling and who is doing some guidelines and standards on prevention and also on how can we address those public health emergencies, which can arise from many impacts, especially from climate change and other outbreaks we experienced last time and this time, like COVID and also the threats like Ebola. But specifically, we can have some health emergencies due to climate changes. We have also One Health position within the ministry, which is new, and we know that One Health is links the people, the livestock, and also the environment. So trying to combine those three in one and do some prevention, do some interventions, it's really a must that we must have at Ministry of Health level. We have changed the mandate of former epidemic surveillance and response at RBC. It was a division called that in that aspect, but it is now called public health emergency. This is because they change their mind, not focusing on epidemics. They change also to public health emergencies. They do some prevention interventions, scale up all those interventions like awareness activities, and also they do some interventions when you have some public health emergencies that occur. We have a new unit at RBC, which has 6 staff, including director, trying to build some implementation activities within the RBC on One Health aspect, linking that aspect I mentioned earlier, linking persons, livestock, and also the environment. But there are some most practices. We are not yet full integrated One Health approach. Those links between one person and environment and livestock. It is still a new concept, not fully implemented. There's inadequate research around this topic, like public health emergencies and climate change interactions. we must have those data that can inform us some decision we can adopt and address your picture of the issues. Next. We can propose some solutions at both strategic level and also operation level. Of course, at strategic level, the government must position itself what is the policy, the contents of policy. We review the analysis, the basis of policy formulation. If we have strategic plan, we do real monitoring, updated monitoring, what are data available on the ground, what can we change as interventions. We review every time and annual review, midterm review, so that we progressively we monitor what is being done and what challenges and the impacts of climate change on health sector. We do adopt institutional structures. Rwanda, we use decentralized policy. How can the interaction between the central level and the decentralized level intervention we can share together in order to address the impact of climate change on health? How do we analyze the stakeholders' involvement? How do we coordinate the governance of stakeholders, which can lead also to the budget resource mobilization, also the public expenditures allocation, to have real impacts, real outcomes from the main activities we are doing. But also there are some solutions we can propose at operation level. If you are designing infrastructure, is it friendly to the climate? Do we adopt the renewable energy, use of solar energy in our hospitals, in our health centers? How can we use efficiently the water available within the community and also in health facilities we have? How the waste management is being done in order, is it friendly to the climate and also to the policy of the we have on environment and also in the climate changing? And also the skills and knowledge of health workers are there at the level of understanding we want. How do we address we scale up awareness of the population around the climate change effects? So those are possible solutions we propose to customize on Rwanda aspect and Rwanda experience we can have to have real impacts on reducing the impacts of climate changes on health system. Thank you very much.
I was thanking you, Dr. Cornell, for your presentation and recommendation that concern Rwanda at national level, central and decentralized area. So I thank all our panelists for the very interesting presentation. So we now going to jump in the Q&A. And I want to remind all the participants that a question can be sent to through the chat. We already have a few, and before to tackle them, I have some questions for you panelists. I'm going to start with you, Mr. Ramon. In the context of healthcare facilities and system, how is climate migration related to resilience?
In Asian setting, thank you for the question, Professor Agnes. In the Asian setting, it is very much related. As we all know, and as I mentioned, hospitals contribute to greenhouse gas emission. However, in low-income setting and even middle-income countries where healthcare is not as big as those found in the US, and that vulnerability is brought about by severe climate events like our own typhoon and huge floodings in the Philippines and what happened in Darwin just a week ago, resilience becomes an issue in itself. And pursuing both mitigation creates resilience. So we don't really make a big difference between one over the other, but it's important to decarbonize. But in the Asian setting, it's more even urgent to build resilience in healthcare facilities.
Thank you, Mr. Ramon. Professor Tarun, the next question is for you. In your presentation, you acknowledge the Aboriginal traditional land owners in Australia when you began your talk. What can we learn more generally from Indigenous knowledge and worldview across the world?
Thank you, Professor Agnes. So it's very important for us in Australia to recognize that everyone who's come here in the last couple of 100 years comes and becomes part of this country, but recognizes that Indigenous people have been here for 60,000 years, which is an extraordinary span of time. And that constitutes about 3,000 generations. And when we do our acknowledgement of country, we pay respect to Aboriginal traditional owners and elders and Aboriginal people, past and present. And as part of that respect as well, we acknowledge that they've stewarded this country from 60,000 years ago or to today, and thank them for that. But we also have to think, how did they do that? Because this is an incredibly unforgiving country. It's huge. It's got all sorts of geographic features, from mountains to deserts to tropical rainforests. And the whole of Australia had different Aboriginal and Torres Strait Islander groups on it. So over 500 languages were spoken at the time of European colonization. And what we have to realize is that it's no accident that this country has been well stewarded. It was based on knowledge, detailed Indigenous knowledge across all of those different environments, specific to this environment that people were living in. And that Indigenous knowledge allowed for survival, because it was not an easy place to survive. And so not only did those 500 different nations survive, but they also left the environment in the same good fashion that that was there thousands of years ago. Now, in less than 200 years, or just over 200 years, we've managed to introduce extraordinary changes to this country. And at the moment, we're finding it difficult to find the will to look forward 10 years or 20 years, which is half a generation. And so what I describe it as is, can we use this Indigenous, first of all, can we respect the Indigenous knowledge? And there's lots to learn from traditional burning practices, for example. Michael mentioned some of this. Ways to conserve water in a very dry continent, all of those things. But can we also use that 3,000 years back and think a little bit further forward as part of that legacy for us? Because we're finding it hard to think 10 years ahead at the moment. So there's a couple of things here. One is to recognize that this isn't just being kind of nice. It's actually about recognizing real expertise and knowledge, respecting that, using it as a cognitive bridge, but also recognizing that Aboriginal people across Australia are still on the front lines. So when we did our inquiry, we talked to Aboriginal groups across Western Australia, and they told us about what they were observing in terms of seasonal changes, the changes in flowering seasons, the changes in animal patterns, breeding times, etc. And all of that information is still there for us if we are humble enough and not so kind of Western and trapped in our mindset. So there's lots of different kinds of science. And, we as a human species progressed well before the Industrial Revolution But at the moment, we're trapped in one way of thinking. And Michael talked about ancient knowledge, and I think, or ancestral knowledge, I think he said. And I think we need to bring that together with our more modern knowledge and not think that we can solve this problem just with our modern knowledge, because we aren't and we can't. Thank you, Agnes.
Thank you very much. It's so true that knowledge is everywhere, but there is too much arrogance in the way the world is thinking to go and search inside communities. So, Michael, what set of actors need to be engaged to build out a sustainable water sector that underpins sustainable health system?
Professor Agnes, thank you for the question. And I think it speaks to what we've been all sort of getting at together in this, and that we are in unusual times that will require really bold actions. And part of that is really getting out of the trap that Karum was just talking about, the traps that we're in that are the way we think about issues. I really appreciate that you've invited me to join this panel. I am not a health expert, but I think the issues that we work in are all so interconnected that is the lesson that I think about, is that we need to continue to expand the networks of folks, the issues that we're thinking about, broaden them so we get the right frame. And I think about, the experiences that I've had that have been successful have been when we work with unusual actors. So, we run an environmental organization, we care about forests, we care about all that stuff. In Peru, we've made huge progress because we've been able to actually reach, we'll say across the aisle and work with the water sector. So we're working with water utilities, water regulators, and moving them in our direction. So the water sector in Peru is now investing at a very significant level, $250 million, into what we call natural infrastructure. So they're not only doing what the water sector has historically done, which is building dams or desalination plants or pipes, they're now investing in restoring wetlands and planting, restoring forests. That kind of, when I think about the actors, it's kind of the unusual cast that needs to be a part of this. It's almost like a recipe for a complex dish like a paella, and you need to have, but there are elements of that. There are ingredients in that recipe that I think will be common when we think about the issues that we all work on. And some of those are, you want to have the enabling environment to work in. You need to have something, whether it's government at a national level or at a local level, whatever, that are enabling and encouraging this kind of new activity to solve these bigger problems. And then fundamentally in the center of that is, again, kind of local communities, local knowledge, indigenous communities. That is, they are the actors. They are the builders. They are and what we need to do is build around them to be able to create that set of actors that are going to be able to solve these problems. But I think it's I think for us to make progress on these issues at a really significant scale, it's going to be unusual partners that we will find. It will be you and I, Agnes, working on a program of climate and health and building something that is not there now, breaking down those traditional silos that we've always worked in. And those languages that we use, even in these presentations, we're using different languages, and we need to find a common language that we can all work around and connect on. So I would, my message would be really, it's kind of unusual actors that we need to be bringing together to solve this problem around the table. And it's at the center of it always will be those local communities that are the ones that are really the front lines, the ones that have had the longest history in these issues. and really have the greatest wisdom around it.
Thank you, Michael. Dr. Corneille, are you more comfortable now? I want to recall the questions. What lesson can the world draw from the Rwandan experience in building resilient health system?
Thank you, Prof. As I mentioned, the lessons learned can be the strong primary healthcare system, which is resilient to the any threat that can occur. As I mentioned, the example of the COVID, which didn't threaten our healthcare system. We have seen that the vaccination rate, the use of family planning, delivery at health facilities is still the same as we used to have before, even though we are conducting national assessment to see during COVID, how did we perform? But having a strong health system and unit of delivery is more like community health workers in a village, or health posts and health centers cannot disrupt delivery of services close to the population. Secondly, the policy and the commitment of the government, which is putting the accountability at high level, performance contracts. Some mayors are signing with His Excellency, which is including also some interventions on climate interventions friendly to the climate interventions, and some committees within the district and sectors which are aiming to do some interventions. Are you examples of leadership and the interventions we are doing in Rwanda? Thank you.
Thank you, Dr. Corneille. I have a question for our host, Dr. Akiki. What is the role of a health professional in promoting a healthy planet, in your point of view?
Thank you so much, Professor Agnes, for this question. Health professionals, and as I said, in the Department of Community Health and Social Medicine, we are privileged to be conducting a flagship module on community-based education. But before I speak about that, I want to speak about who the players are in building resilient health systems. I will not address the decentralized health system that Dr. Ntahibose has talked about, that is in Rwanda, but I'll talk more about the human resources and the appropriate training of those human resources, which is the business that UGHE is in. We are really privileged that we are doing this at this time when we need young people on deck, at hand, taking on the whole complex issue of responding to the challenges of climate change. The world we are in is not the world they're going to practice in. And so we are training them in a different way so that they are able to respond. To begin with, where UGHE is built in a rural area of northern Rwanda. So for 3 hours, our students travel from the capital to rural northern Rwanda. They are able actually to already have an encounter of nature, the invisible health system that one of our speakers talked about, and to see how we need to be able to look after this invisible natural health system if we are to indeed reach the most vulnerable people, which is the vision of UGHE, preferential option for the poor in health. So we use different platforms than the usual ones. We do not only train in class, but we train right in community. Right from day one, our medical students are exposed to where they live as part of a teaching platform. We take our students outside, we encourage them and we lead them to interact with community, to walk into the community and see the stressors of health, the social determinants of health that surround us. And this forms the important foundation of the training of our health professionals. We train our health professionals not only to be professional, but to be advocates, as health advocates for health inequities that are going to be even more pronounced with the impacts of climate change. We train them to be leaders because they will lead, they are the ones who will be able to be the voice for the professionals and for the voice for the communities that we work for. Teach them to be collaborators, that we cannot do this job alone as health professionals. We are not saviors of the world alone as health professionals, but we work with other people globally, in the community, and other actors in the health professions. Of note is the One Health concept, that we have a center for the One Health concept. We have a center for global health delivery. We have a center for gender. We have a center for community engagement. We have a center for nursing and midwifery. We have an executive education center for people who are already in practice. So we practice interprofessional education so that we know who to hold hands with as we tackle these things. We teach our professionals that they must be good communicators. They must be good communicators because we have to indeed be able to have a voice indeed for ourselves and a voice for the people that we serve. Maybe I'll stop there because I could go on and on, but we aim at is transformational education.
And you join what Michael said about transformational collaboration, unusual intersectorial collaboration, and also what Dr. Tarun says about go and found the knowledge that exists out there since generations and that we are neglecting. Dr. Ramon, the next question is for you. In countries like those found in Southeast Asia, what should policymakers pay attention to in terms of resilience in health sector?
There are few countries in Southeast Asia. One is the Philippines and one is Vietnam, where they enacted or adopted unique policies. For example, in Vietnam, the Ministry of Health there subscribed to no plastic, no single-use plastic, and towards reduction of plastics within the healthcare facility. So they came out with a comprehensive policy to discourage utilization of plastic spoons, plastic bags across hospitals, public hospitals. And of course, we know that plastic is also a climate issue as well. In the Philippines, more than a year ago, the Ministry of Health adopted this resilient investment in healthcare facilities, a 20-year development plan. And we managed to be part of it as Healthcare Without Harm. We were taken in as part of the consultant group that were that inputted into the resilience in healthcare facilities. And then they match it with how much money should be invested into healthcare facilities in the next 20 years. And so we're now watching out how this money will be utilized and indeed come up compared to 20 years ago with more resilient, more climate attuned kind of facilities in our country. So these are two examples of policies that we supported and we deem as resilience policies. Thank you.
Thank you, Mr. Rahman. Professor Tarun, you mentioned the need to target groups most vulnerable to climate change. How should we do that for success?
Thank you, Professor Agnes. I think the answer is carefully. I was very interested to hear Dr. Akiki describe the community interventions, the engagement, the preferential option for the poor. So the history of public health intervening on behalf of the vulnerable and the voiceless is very strong and part of a social justice tradition that we should value. On the other hand, we've just got to be careful, because we are part of government often, that naming of vulnerable groups is perceived in the right way and doesn't become part of the problem, that you see people as only vulnerable, as a problem for you to fix from government. So we have to be careful. I think we've seen it in COVID. So I'll give a couple of examples where some of the lockdowns in Australia that I have observed have been fairly poorly done, probably well-intentioned, but some of the very specific local lockdowns have been targeted at vulnerable groups, but many of whom lived in what we call social housing, many of whom had arrived in Australia recently, and the intervention was perceived as heavy-handed and had a strong police presence, for example, which was seen by those people as stigma and discriminatory. And so trying to help, we could also subconsciously blame people or end up blaming people. So all I'd say is that we also have to see the other side of vulnerability, which is resilience. So I think we always have to take a strengths-based approach to however vulnerable a community is, and find out first why they're still there. Who are the, what is the strengths in that community, and then work with people and build on it. Because no group is purely vulnerable. Everyone has strength and resilience and humor and capacity, and we have to do that. So the good example I'll give is, I was also involved in getting vaccines out to remote Aboriginal communities, where we targeted those communities because they were high need for the COVID vaccine. They had low uptake, and the government worked with the Aboriginal community controlled organisations and health services to make sure that we offered vaccine door to door in very remote parts of Australia, and dealt with all the issues people had face to face and with local people beside us. So I think you can do it, but we should be careful about the language of vulnerability, that it doesn't inadvertently stigmatize and reinforce a Western kind of interventionist, we know everything kind of attitude. Thank you.
Thank you, Dr. Tarun. So it's also making everybody around the table when don't do for me without me. And the participatory approach is a very good solution to avoid that, and also to extract from the community we want to serve solutions that are already there and build on that. Yeah. Dr. Corneille, how vulnerable is the health sector vis-a-vis climate change?
Thank you, Prof. The health sector is vulnerable because it costs a lot to achieve the performance registered in many sectors. Maternal mortality reduction, child mortality reduction, and other performance. But it is very quick to reverse, undermine, and also to slow down because of climate has impacted the health system. If, for example, there is a bridge which was destroyed, if it is a road which was destroyed, or some houses, So government allocate maybe some money from health sector to rebuilding those infrastructure that has been destroyed. The other aspect is the destruction of socio-economic determinants of health, which are destroyed and has impact on some outcomes of health, and also some direct impact like deaths. There is an increase of deaths from the direct impact of the climate change. So the health sector is very vulnerable because of there are many ways we are feeling impacts from direct and other indirect like reduction of those resources I mentioned earlier. Thank you.
Thank you, Dr. Corneille. So it's again a multi-sectoral issue, can be a road, can be a bridge. It's that help to people to access care, but not out of the health sector. So multi-sectorial approach. Michael, you have mentioned on sustainable ways to take care of our environment to reduce the risk of climate change. What are some of the obstacles that you are encountering in this work?
Here, yeah. Agnes, you will certainly appreciate this. You've mentioned it already. It's really the scale and the scope and the urgency of this issue. And can we, the institutions we have built over the last centuries, are they really the right institutions we need to be able to solve these problems? And I think even more fundamental to that is, are we as a species kind of equipped to deal with these kinds of issues? Multi-sectoral, multi-generational, all of these things that are circles of complication. Are we equipped? We live a short life, right? We have a seat we have for a short period of time here. How can we think about, 60,000 years as the Aboriginal people in Western Australia think about? How can we, we can barely plan 4 years ahead or 10 years ahead, which are, of course, timescales that are completely wrong for the sets of issues we want to work on. And we tend to be, I think, conservative, right? As a species, we're built to avoid risk, and I think we need to rewire ourselves somehow to say that that's not what we need now. We need boldness. We need what Dr. Kiki was saying that's so beautiful about what you guys are creating at the university, right? We need a really new way of thinking about issues. We need people that have that can cross discipline boundaries, cross cultural boundaries, cross language boundaries, and that's what we want to be training people to do, not to be an expert in this necessarily or that. And so I think that the obstacles are really just the structures that we have built for many years that now are becoming obstacles to us dealing with the issues that we need to deal with. And I don't really know whether we as a species are equipped for this. I mean, can we really take on these global challenges that have so many complicated dimensions to them and still care about ourselves, care about our families, care about our communities? How many of us can start to be thinking in those sets of circles that are so important? So there's a lot of challenge ahead of us, but there's also a lot of wonderful opportunities, I think, and there's great talent, and I love this panel, and I love what you guys are doing at the university. That is what we need more of.
Thank you, Michael. And you are right. It's a very scary time because our species is at risk and because of ourselves. And we know it. And you realistically ask if are we ready to do what it takes to save ourselves. Ramon, I see your hands. Say something. Sorry.
I also wrote a short email to Praise just now, because I mentioned earlier that I need to go much earlier because I have another important meeting happening now, and I'm already late by 15-20 minutes. So, but I want to address this particular question in the chat. How does MOH collaborate with other national and international organizations in various countries? In the COP26 held last November, there were two sets of countries that made commitments vis-a-vis climate and health. And this was coordinated by the WHO, the UN Climate Change Conference that time around hosted by Glasgow, and then Healthcare Without Harm as the NGO entity helping out on global climate and health issues. So the two commitment areas were, on one, climate resilient systems, and there are multiple countries that have enlisted themselves there. But much more challenging is on the commitment area 2 on sustainable low carbon health systems. That is a commitment by 2050 to deliberately reduce emission down to zero across healthcare systems in countries. And I think there are now about 60 countries that committed to that. So what we're saying, therefore, is that it is not only that this can be done at the facility level, but at the policy and national level, and then healthcare sector contributing big time into carbon reduction together with other sectors and industries, that can happen, and that is already being done. And there's no choice anyway, because the whole climate crisis is a very urgent one that we need to act now, and we need to act on a system scale, not only as a local government, not only as a local facility, but as countries, as healthcare industry or sector. Thank you so much. But I need to go.
Yes, and we really appreciate your availability. We learn a lot from you. Thank you very much, Ramon. And if there is other question, we will send to you through email for being answered through social media. So, Dr. Akiki, you talk about the role in education. Now, once at work, what is the role of health professionals in promoting a healthy planet?
Thank you, Professor Agnes. As I listened to the other panelists, what I thought I could answer to a question like that sounds even more inadequate, because I realize more and more what we just as health professionals need to be and to know and to continue to learn to be able to contribute effectively to the issues of climate change. And those actually that is in line in the way that we are training our health professionals to know that we are collaborators with the local communities that we work with the global communities that we work with, and therefore to have respect, as Dr. Tarun talked about, to have respect that we are learning with and with the communities that we live in, especially the indigenous people of the lands that we are in, and also to recognize the contribution of the global community. So as a health professional who is aware that where we are placed, that we are actually not the depositories of answers, but ours is to be like scholars who will look for the answers for where we are and join hands with the fraternities we are in at community level and globally to be able to do what we need to do. Then we need to be, as clinicians, because this is our area of specialty, to also have quality training, quality service, so that we are ready to respond to the issues that come up. COVID has taught us that to be prepared, we cannot do it immediately. It was that long-standing preparedness of health professionals, health systems that, for example, helped Rwanda to respond excellently as they did. So as a health professional, we have to require more of ourselves as scholars, as researchers, as communicators, so that we are able to respond appropriately and in time. And then also the values. What are our values? What are our attitudes? I think that is very important. And wherever we are, health professionals are leaders. We are leaders and will be looked at in the way, or in what our values are, what our attitudes are, and our readiness to collaborate.
Thank you, Professor Akiki. Professor Tarun, there is a complement to the question to Dr. Akiki. What do we as health leaders need to do differently and urgently to make the most difference?
I was really struck by what Dr. Akiki said, and I'd just like to pick it up in terms of the senior health professional, because I've spent a lot of time since our inquiry talking to different professional groups and all different kinds of specialists and generalists, medical, nursing, everyone. And the only thing that you can't say is we're not powerful, because we are. We definitely have power. And if we don't use the power we have, then we can't expect other people to act. We have to act, and we have to use our power. Now, how do we do that? There's a paradox here in that the more senior you are, the less you have to know. Meaning, you know your specialty, but you have built up a whole lot of reputational capital so that you can say, I don't know anything about climate or the environment, but who does? And we're all on lots of different committees. And if you want to make change in a minute of your time, all you have to do is get onto the agenda for the next meeting an item that says environment and sustainability. And when that item comes on the agenda, you as the senior person says, I don't know anything about it, but who does? Because in your circle, in your networks, there will be younger people, there will be all sorts of people who do know, who can give you guidance. There's huge networks out there you can just tap into for this. And Ramon runs one that we've heard about. All the technical answers are actually there. It's about creating the networks and supporting people, and then allowing people to make changes in your own department or hospital or community health center. And you as the senior person, all you have to do is support and allow the question, not have the answers. And I think that's really good message, in that the most powerful interventions are from the people who have never talked about climate or the environment before. And then if you say, I'm a cardiologist, but I feel that this is important, who knows about it? Then you're going to really lead change without having any knowledge yourself.
Thank you. So true. Michael, given what has been discussed here on the role of each one in different sectors, to put forward action to mitigate climate change effect and the different recommendations proposed, could you please tell us what in actually and practical way we can envisage the next step at local, regional level to build solutions?
Yeah, good. That's the right question, right? We want to take this conversation that's at theoretical levels and say, okay, what can we do with this? What are tangible things to do? I guess I would like to test with this group a theory, or at least a principle that we can start with, which is that, you know, if we're building sustainable health systems to counteract the effects of climate change, it starts with recognizing that nature is the forgotten root of health, right? We talked about this before. The hidden health system is actually nature, the planet we live on. And I think if we can embrace that, that can be kind of an organizing theory for all of us. But I would love to think about practical next steps. So we've done a lot of work in Peru at a national level. We have attention of a lot of agencies, donors, and I think we would just need to keep expanding what we're doing there. You know, we're talking about natural infrastructure, we're talking about water security. We need to bring the expertise of your university to be able to help us communicate the health dimensions of that approach. So everything we do will have a climate element in it. And I think that's the thinking that I hope we all are left with, is that every regardless of the sector, regardless of the type of institution, you know, climate and the environment needs to be a part of everything we do. I think that's what our current government in the United States is trying to do. When you think about different sectors like transportation, is what's the climate envelope, or what's the climate element of that activity? So I think that would be a good next step for all of us, would be to examine what we do with a lens of climate, and then search out unusual suspects. I mean, I would love to work with you guys and hang out with you, Dr. Akiki, and really think about the next generation of leaders, who I think about in terms of, like, they're translators, basically. The incredible asset that the health community, the health system brings to the world is that they're everywhere, right? We are everywhere. You are everywhere. And so you are amazing messengers. You're amazing translators that can be in that critical role of leading the charge against climate change. So I hold out my hand and say, I want to work with you guys. That is my next practical step.
We take the offer. You'll hear from us.
That's
so
good.
We are reaching the end of the webinar. There is a question from Ernest Muhirwa. Ernest, Dr. Corneille will answer that through social media. We will make sure that you'll get that that answer through Twitter. What about how the health sector in Rwanda is prepared to other threats, volcano, etc. That's a reminder to each and everyone that the questions that are there, Hassan, there is also 2 questions from you, will be answered through using Twitter and Instagram and the hashtag Ask Professor Agnes. You will get your answer there, as well as the others who have asked questions. I just have 1 minute to thank our great panelists. Thank you very much. We learned a lot. We have tips to go in the community we want to serve, to get traditional knowledge, to behave better, to collaborate differently. And the webinar itself will be put on YouTube. So many people who are not able for time zone or whatever to follow it can watch it. And again, thank you. And I thank you, Dr. Akiki, for hosting us. We have a lot on our plate. We have a lot to change. We can make it. but the window is narrow every day for our own survival. So if we want our children and our grandchildren to have a planet where they can live, we have to follow those great recommendations posted today. And I will give you an appointment for the next Ask Professor Agnes webinar coming next month. Thank you, all of you. And it was a great panel. We learned a lot. Bye-bye.
Bye-bye.
Bye-bye, Prof.
Thank you.
Thank you very much.
Bye.